Welcome back. Are you dealing with pain in your foot, your shoulder, your knee, maybe backaches? You don't have to let it control your life.
No, New England Spine and Disc offers a non-surgical solution that can give you lasting relief. And here to tell us all about it are Dr. Richard Carpenos and his patient, Holly Brick. Thank you so much for being here.
Thank you.
Great to be here with you guys. It's so nice to see two lovely ladies.
Oh, thank you so much. And I've been seeing these segments all the time on Great Day Connecticut, so now I actually get to see it right now in living color.
So if you're wondering, you know, a lot of people out there are suffering from pain, arthritis, and all these different things, and they're thinking the only option is injections or surgery. This is an alternative. Holly, tell me about the pain you were having and how this has helped you.
So I had a skiing accident back in February and was not getting any relief. I called Dr. Carpenos and said, I injured my knee, can you help? And he said, come on down. And he introduced me to the soft wave, and now I'm training for a half marathon next February. So it definitely works.
Yeah.
So what was the process like when you went to Dr. Carpenos?
They looked at it, they looked at the x-rays that I had done, and I pointed out where the pain was, and he sat me down with the machine and did the treatment and got through it, and not having pain now.
And Dr. Carpenos, I know many of you who are our loyal viewers may have seen this with other people, but just explain what this is, because it's a kind of stem cell therapy?
You're activating your dormant stem cells. That's the big thing that it does. We have these stem cells that are lying dormant in our bone marrow. In fact, when you die, 50% or more of our stem cells are never even activated our whole lives.
Wow.
So this is kind of like a new frontier in healthcare where we're actually being able to activate it using sound waves. So the only thing that goes into your knee, shoulder, elbow, plantar fasciitis, neuropathy, tendon problems. I'm bone on my right knee. I run 10 miles. Holly said she's training for a half marathon, right?
Yep.
And she's an aggressive skier. We see a lot of athletes. We see a lot of older people with arthritis, and they're bone on bone. And the last thing you really want to do is put a catabolic agent that's destructive, like a steroid injection, in there, because it shuts down the inflammation. It doesn't allow any healing at all, and it can be destructive. And then you end up getting a knee replacement, which is best if you can avoid it. If you need it, there's great surgeons out there who do a wonderful job, but I would definitely do this.
And you're going to show us how it works.
Sure, I'd love to. It's really simple. We just put a little gel on Holly's knee, ultrasound gel, just to conduct the sound waves. Again, if you have a pacemaker, there's no electricity going into Holly at all. It's just sound waves. And you can hear the sound, it's coming out in a pulse.
Okay.
So think of it as lightning in here, and the thunder is going into the knee. But, you know, we can make it very gentle, or we can make it a little uncomfortable. We want to find where the inflammation is.
Does it work on most people, everyone, or some people? I guess you know after a first couple of sessions if it's worth it.
Yes.
You know immediately. That's why we do this $49 introduction. It's a full treatment and evaluation, and then we find out if you're a good candidate. Most people seem to be. So I tell my patients, if you're one number of improvement, so let's say you're a 10 when you come in, and you're a 9 in 3 minutes, that's all I really need to know. We can get you the rest of the way. If you feel exactly the same, you're not likely a good candidate, and I don't recommend to go further. We have all kinds of ways to pay for this procedure. It's not break the bank expensive, and we offer payment plans. But that first visit is $49, and then it's usually about 6 to 10 visits, depending upon your problem. And it's slightly more expensive, but we work out payment plans. And there's no insurance that pays for this unless you have an HSA or a flex spending account.
Okay, so you can apply that towards this.
Yeah,
Wonderful.
it'll pay for this. But it works on elbows, shoulders, knees. You know, if you're thinking about surgery or injections or even physical therapy, I would do this first.
Try it. See if it works.
It's so quick.
Less than 30 seconds. What do you want to say to people who are on the fence?
If you're on the fence, go see Dr. Carpenos, pay the $49, spend 3 minutes with the treatment, and see if it'll help you.
Okay.
Yeah.
Easy enough.
Yeah.
So we'll tell everyone, because New England Spine and Disc is a local business here in Connecticut, right on the Boston Post Road in Orange. And to get in touch with Dr. Carpenos and his team, all you have to do is schedule a consultation. The number's there. It's 203-799-3472, or, very easy, 1-800 pain-free.
All right. You can also visit newenglandspineanddisc.com. Thank you so much.
Thanks, guys.
Good luck, too.
Thank you very much.